And I wanted to go ahead and record this video because I get a lot of questions in regards to patients or relatives or family friends that have someone that has tested positive for COVID-19. And there's a lot of misinformation about what treatments are available and what to do. I've seen a number of urgent care facilities and outpatient prescribers issuing prescriptions for treatment products that do not have a strong recommendation or indication for using as COVID-19 treatment. For example, ivermectin. Hi, my name is Dr. D. I am a clinical pharmacist, and I wanted to go ahead and record this video because I get a lot of questions in regards to patients or relatives or family friends that have someone that has tested positive for COVID-19. And there's a lot of misinformation about what treatments are available and what to do. I've seen a number of urgent care facilities and outpatient prescribers issuing prescriptions for treatment products that do not have a strong recommendation or indication for using as COVID-19 treatment. For example, ivermectin. So I wanted to share this video to, one, show you the proper way to find proven COVID treatment if you are an outpatient that has been recently diagnosed with COVID. One of the things that a lot of people don't realize is that there are infusion treatments and injectable treatments that are currently allowed for use for treatment of COVID-19 to prevent certain patients that meet criteria from developing worsening COVID symptoms and preventing them from ending up in the hospital. These products are infusible. They're called monoclonal antibodies. There has been authorization to use them via IV infusion, as well as via now subcutaneous or under the skin infusions. The benefit of these products is that it does help reduce the severity of symptoms in someone who's already diagnosed with COVID-19. And it does carry availability for those who are not hospitalized to get a scientifically proven treatment that does actually work to help treat COVID patients. So what these monoclonal antibodies do is they're basically giving your body the antibodies to help fight COVID-19. So what happens when a patient is infected with COVID-19, your body does try to develop its own antibodies or build an army in your immune system, so to speak, to take out the COVID-19. However, some people's immune systems are a little bit more efficient than others at doing this. In the instance where it does take a lot of work, energy, and it doesn't feel good while they're going through the process of their body generating these antibodies, monoclonal antibodies that are infused for the treatment of COVID-19 can help jumpstart your immune system's fight back response, so to speak. So we think about vaccines and the parable of you teach a man to fish versus giving the man fish for a day and he only eats for that day. But if he learns how to fish, he knows how to handle himself and get more meals over the long-term period and can survive. So in the case of a patient that contracts COVID-19, they need to, quote unquote, have their meals fed then. So the monoclonal antibodies serve as a treatment to immediately inject those antibodies that your body needs to fight off COVID-19. Now, with that being said, there are a number of restrictions or specific criteria that must be utilized to make a patient eligible to receive those infusions. But the first thing I want to show you is how to find out where those infusions are available near you. We live in a day and age where technology is, very advanced, and we have access to a lot more things than we did in the past. And one of the pluses is being able to find yourself COVID-19 treatment facilities if you have recently been diagnosed with COVID-19. Now, I'm finding that a lot of people don't know this information, so I'm taking the time to share it and show you step by step how you can find by zip code areas that offer these monoclonal antibody infusion treatments for COVID-19 positive patients that are not currently hospitalized. So let me bring up my screen to share it with you really quickly. So the Federal Department of Health and Human Services has a website that shows you where these COVID-19 therapeutic products have been shipped to. So this website is extremely helpful if you go to protect-public.hhs.gov/pages/therapeutics-distribution. This is what the screen will look like. I will leave a link to this particular page in the notes section of this video so that you can also click back to it and find it for yourself. Now, currently, there's a couple of monoclonal antibodies that are currently available for emergency use authorization, which basically means we're in a pandemic. The FDA has said, okay, these aren't fully FDA approved, but you can use these in a pandemic because the paperwork takes a long time. These products have been tested, so it's not like it's just pulling it off the shelf and we don't know anything about what they do. It has been tested. FDA approval just takes a lot of paperwork. So monoclonal antibody treatments would include bamlanivimab, which is usually very hard to say. Some people call it BAM for short. And then there's also the therapeutic cocktail Regeneron, which contains two different monoclonal antibody products that kind of work together to help fight COVID-19. So if you scroll down, once you get to this page, you'll see a map. This map shows the treatment centers that have received these monoclonal infusion antibody products. If you take a look on the left side of the screen here, you can search by your address or zip code. So let's look for a treatment center in Washington, D.C. So once you enter your address or your zip code, you can adjust the radius for your search around that area. So you can expand it and go within a 28 to 50 is the maximum mile radius to find treatment centers that have COVID-19 infusible products. If we enter Washington, D.C., and we just look at this about 13-mile radius, we'll see that there are a number of hospitals that are listed here on the left to find that have received COVID-19 therapeutic monoclonal antibody shipments. Some of these hospitals will have the phone number listed within this search. However, if you don't see the phone number listed, please feel free to Google that hospital and find that phone number. Let's take a look, for example, at Atlanta, Georgia. When you look at some of the options that are here, keep in mind that there are a number of hospitals that may potentially be saturated for emergency room visits. However, these products are infused in what's called an infusion treatment center, which is often almost acting like a hybrid of an inpatient to outpatient. But the bulk of those patients are those who are not admitted to the hospital and need some type of IV infusion treatment. Let's look specifically, oops, I know exactly what we'll look for. Let's look specifically in Douglasville, Georgia, at what options they have available. So they see here that there are sites, this shipment site received shipments of COVID-19 therapeutics. However, they have not uploaded the contact phone number for that particular facility. Let's go back to Atlanta, Georgia. When we look here, we see that Emory University Hospital did indeed receive shipments of COVID-19 treatment products. So the next thing I want to do is find this hospital contact information. So I just simply put in the address and Googled and found the hospital's information. And what I want to do is find the main contact phone number of that hospital, which is listed here. And you want to give them a call to find out where the patient can get infusion treatment for COVID-19 monoclonal antibodies. What you want to ask the operator on that phone number is if they can transfer you to either the outpatient infusion center or the center where the COVID-19 infusible monoclonal antibody treatments are administered. The next thing I want to go over is some of the criteria that is used for determining whether or not a patient is eligible for treatment with the monoclonal antibodies. So this site here is also from the U.S. Department of Health and Human Services. It details some COVID-19 treatment therapeutics and provides a good summary as well. I will also leave a link to this in the notes underneath the video. So these monoclonal antibody therapies require some criteria to be met for a patient to be eligible. One of the things that's most important is time. So patients who are COVID-19 positive really want to make sure they're seeking these monoclonal antibody treatments as close to the positivity date as possible. So these products are approved for treatment in patients who've had no more than 10 days from their symptom onset. Patients that are considered experiencing mild to moderate symptoms, meaning these are the patients that are not going to be hospitalized and not going to be on ventilators and not, super severe. These patients also must be considered at high risk of developing a severe disease. So this can include patients with chronic conditions such as cardiovascular disease, for instance. COVID-19 vaccinated and unvaccinated patients that meet this criteria are able to receive these monoclonal antibody infusions. And right now, the emergency use authorization is for patients ages 12 and older. So before you try to self-treat, I would encourage people to seek urgent medical attention if they think they have COVID-19 or if they have been recently diagnosed with COVID-19. They definitely need to seek help from a medical facility as soon as possible. Now, these monoclonal antibodies treatments do have evidence and do work. So that's the reason I want to get this information out there and make sure that people know how to find the proper treatment in a timely fashion. Some of the orders that we've seen on the outpatient side, such as ivermectin, and we all remember the hydroxychloroquine big saga, some of it doesn't have strong evidence for use in COVID-19 patients versus these monoclonal antibody treatments do. So the sooner you can get to proven effective treatment, the better off you will be. So please share this information with your loved ones. Anybody that you know that becomes recently diagnosed with COVID-19, look up this information. Don't just take it because I'm telling you. I'll leave links to all of the facts and sources underneath this video, but I want to make sure that you guys are aware of this because a lot of patients that I've seen and relatives are saying no one's telling them this. So please, please, please make sure to seek care for yourself and make sure that the care that you're seeking is sound medicine practice. We have the term evidence-based medicine for a reason. Some of the treatments that we're seeing are grasping at straws, but this monoclonal antibody treatment is something that does help with COVID patients that are outpatient and not hospitalized. So again, my name is Dr. D. This is Real Talk Health. I will periodically post things that are of utmost importance health-wise, to make sure that you all are getting factual, evidence-based information. Don't just take what I say. Like I said, talk to your healthcare professional about this information. And again, using that website that I showed you, monoclonal antibody treatment for COVID-19 is available near you. You just need to find it, identify it, ask for the appointment, and seek it out. So thank you for watching, and hopefully you guys stay safe out there during this time.